WVLK, Dr. Kevin Kavanagh is with us now. Dr. Kevin Kavanagh, good morning, sir.
Good morning, Jack.
Well, we have lots to talk about this morning, and of course, we need to talk about the president and the condition that he is in as we know it right now. I feel like the medical people at Walter Reed haven't been totally forthcoming. What do you think?
Well, I don't think so, but I'll be honest with you, Jack. For me, that's not a huge issue. I mean, this is also a national security issue. And if you go back in history, seldom have you ever had a president who succumbs to a huge illness and people are forthright. Because believe me, you've got our adversaries that are listening and trying to find out what the weaknesses are. And I think that they really want to make sure that they have things shored up before they release information into the public. So I have not been that concerned. I also haven't been that concerned by the fact that they chose the monoclonal antibodies for treatment. As you know, Friday morning, I chose that as number one. Early stage of the illness, to me, that's the best therapy you could possibly have because it's an old type of a therapy, giving antibodies. Convalescent serum has been used for over a century. And monoclonal antibodies have been used for quite a while. Now, of course, this product is brand new, but initial results, especially of the other competing product of Eli Lilly and convalescent serum, early in the disease, initial results are very good. So I think that was a wise move. I am very concerned that we're not in the initial disease with the president. His oxygen level has been reported to have dropped twice, both on Friday and Saturday. And it's pretty hard to believe that you would first find out that you're sick on Friday morning and then have all of a sudden in the hospital, low oxygen, and possibly even given steroids at that time on Friday. That to me is concerning. And so, of course, is the steroid.
What is dexamethasone?
Well, dexamethasone is a steroid, and it's an immunosuppressant, and that is one of the drugs which is shown to have a positive impact but only on severely sick patients. Because if you were to give it, for example, if you just had the flu, or if you're mildly sick, what it does is suppress your immunity. And when it suppresses your immunity, it can make the infection worse. By giving this drug, they are worried that he's gone into a hyperimmune type of response or is at risk of going into that type of response. And as you know, there's immune, not immune, and hyperimmune, and that's what they're worried about. The other problem with this drug is, and I can tell you just taking a little bit of steroids, like 5 milligrams of prednisone for my arthritis, is that they're a miracle drug. You feel great afterwards. And he's on quite higher doses of that. And I'm telling you, you cannot follow his symptoms when you're on steroids. It can suppress your temperature. It can make you feel great. It can boost your energy. And if for someone that has arthritis, it's a drug that's a cure for the next day. But unfortunately, you can't stay on them for a long time. And when you have an infection, there's a downside. So I think he's in some trouble.
What about Remdesivir is another treatment that they've given him?
Yes, Remdesivir, as you know, has shown some promise, but there's been 2 randomized trials on Remdesivir, both of which would just have to state has shown mediocre results. The last one had only positive results in one of the 2 control arms, and they concluded that they didn't know how clinically significant they were. And they were looking at endpoints of improving symptoms, things like this. So it's probably good to use, and certainly I'd want to use it, but it's not a miracle drug, and given sooner the better. And like I said before, I'm concerned he was pretty far into this before they started treatment.
Now, did getting in the car and taking a little joyride, did that make sense?
Only if you're psychotic on steroids. That made no sense at all, Jack. And I don't want to be light on that issue. It's very, very concerning. That's a closed vehicle. There's no airflow in it at all. I mean, it has to defend against gas attacks. And those 2 people sitting in the front car, the 2 Secret Service agents, were exposed and unnecessary. There was no upside to this. They weren't in full hazmat gear. Yes, they were wearing eye protection and N95 mask and a gown, but that's not a hazmat suit. That close with that much viral load that could be shedding, undue risk. It was an unnecessary risk, and that's not something I think was wise to do.
And they say now that he may go home today. Would we assume that he would be quarantined for a certain amount of time if he does go home?
Well, definitely. But the listeners need to remember that going home to the White House is different than going home to your house or my house. They have quite a lot of medical facilities there. So he'll still be able to be monitored. What is concerning is that this virus can go south quite rapidly. We kind of saw that on Friday. This can happen again. You kind of get better, then you can go south. And if that happens in the White House and he needs intensive care, will they be able to give that to him or get him transported in a rapid fashion? So I'd be a little careful on that. I'm also concerned about coagulopathies or forming clots. That's another big thing that you have to look for. And in my opinion, I think at this point he should receive some form of anticoagulation. It may just be the low dose molecular heparin type of anticoagulation, but this is a big problem with this virus because, as we discussed before, people think it's a respiratory virus, but it really affects the lungs and heart first. If you can remember what they stated, and you commonly hear this, his blood oxygen was low, but yet he wasn't short of breath. Why? Because it's affecting and dilating the vessels in the lungs. And so this is very concerning. He has a full case of this, and I think the viewers need to look at the urgency, the type of treatments that are being given, and it is very appropriate to give those treatments to the president. But Jack, these type of treatments are not available to the public yet, and that's why I think we need to flatten the curve.
Very good. Dr. Kevin Kavanagh, thank you so much.
Thank you, Jack. I appreciate it.
Dr. Kevin Kavanagh,